Hi, my name's Michelle Lilienthal, and I'm the Trauma and Burn Program Manager. And we just talked about the different injuries that our trauma patients encounter and some of the reasons why we would need to have a chest tube. And now I want to go through the chest tube that we use here at the university. It's the Atrium Oasis. It's a dry suction water seal unit. And when you're helping set up for this, it's really important to know several things, as well as when you're monitoring a patient who already has one of these in. So you get it out of the package, and the first thing that you need to do as the nurse is get the water seal established. And this unit has a pre-packaged amount of water that's right here located in the back of the unit. Break this off. There's a little tab at the top that you need to break, and then that all gets inserted right here into this blue chamber. When you put this water in here, you deliver all of the amount, and what you should see is that this changes color. There's a blue dye in here, and you'll know that you've got the water in and the water seal is established. The amount of water here fills this up to the line that's indicated here by this triangle. So while the doctors are getting the chest tube inserted, you're doing that. You're also getting the wall suction set up. And the wall suction, once that is all set up, you can hook that suction right here to the same chamber where we've just stuck the water in. It seems counterintuitive, but it is the same place. So once they've gotten the chest tube in place, and this is a thoracostomy tube, once they've gotten it in place, you're going to be hooking up, helping them by handing them the end of this. They're going to hook up to that thoracostomy tube, and then we're going to start making our assessments. So, first chamber here is the dry suction control. And it always comes out of the box at -20, but you want to just make sure about that. And that's the majority of the time, that's the way we keep it. And if the doctors decide that they need to change that, they'll tell you. And if for some reason you ever needed to change that dial, here is how you do that. Off here to the side is a little windmill thing that you can rotate, and you can see how that changes that orange dial, or the amount of negative pressure. But most of the time it's always at -20. Then you want to look at the water seal chamber, and I think that this is the most important chamber on these units for you to try to understand and know what to look for. And again, I'm going to emphasize the water seal chamber. This is a water seal unit. It's not going to work if you don't have water in the water seal. So that's why it's so important. You have an air leak in this chamber. If a patient has a hemothorax or any kind of a component of a hemothorax, you're going to be collecting the fluid that comes out. It is frequently we put them on a off or get rid of them so that they aren't erroneously clamped. When this drainage unit is full and you need to switch to a new one, you want to get the new drainage unit out, make sure that you've established the water seal in that new unit, and even to change out to that new one, you can clamp, you can hold, you just disconnect and hook on to the new one, and you would definitely